Hello, everyone. Dr. Scott Stoll here, co-founder of the Plant Nutrition Project. And today, it's my sincere pleasure to welcome Michelle Kramer. Now, Michelle is going to be on our panel at the PBNHC, the final panel that we have that really looks at the application of nutrition, whole food plant-based nutrition in clinical practice. And this is the first year that I've invited a health coach, and it really represents, I think, a recognition amongst all of us how critical health coaching is to the success of anybody that's trying to adopt a healthier lifestyle. So Michelle, welcome. I'm so glad you're here.
Thank you. So happy to be here with you, Scott.
Thank you. And thanks for joining us on the panel this year. I'm so excited that you're going to be a part of our panel. It's going to, I think, really add a whole new lens for people in attendance to see life through your experience in caring for people.
Thank you. I'm so honored and excited to be part of this panel. I'm jumping up for joy inside. I'll just jump now. So thank you. Thank you for inviting me this year.
So I know that you have worked very closely with medical teams, Dr. Sal Lakagina and others, in this shared medical care for patients. And maybe just for those people that are watching, describe how that relationship works and why it's so powerful and important for health coaches and clinicians to partner together.
Well, it's been such an amazing year, especially I should say really the last 2 years with COVID, and how I have seen a real difference in my practice over the last 12 years of just the last 2 years of teams coming together more than ever. And one of the things that I've been able to do is to support my clients is to be part of their team. So working with lifestyle medicine doctors, finding them lifestyle medicine doctors, building relationships with their doctors. Maybe they're not a lifestyle medicine doctor, but being able to partner with their physicians, their physical therapists, their trainers, whoever it is that's part of their health team, so that we're all on the same page. And what I've found is that my clients are getting greater results having a team. And so I'm kind of that middleman. So when a client or patient leaves the doctor, they're told to exercise and eat better. They might tell their doctor that they have stress in their life, but they don't really have a lot of time to sit down and talk about what type of stress that they're dealing with. And so I'm that person that is every day in communication with them. And then also letting the physician know and being in communication with their physician that, this is what Sally did for the last week, and we're tracking it and we're measuring it. And so it's a win-win for all of us to be working together as a team.
Yeah, it is a win-win. Absolutely. And, you're on the front lines helping rewire people's brains to make different choices, right? As a clinician, I can sit in my office and I can give them the information, I can talk about the science, and then I send them out into the world where they've lived a lifetime, struggling against choices and in a culture that doesn't support a healthy lifestyle choice. And, it's really unrealistic for me as a clinician to believe that that person has all of the resources, support, accountability, encouragement, inspiration to make that change in between office visits.
Yes.
And so, that's where you come into play. And, maybe share with people, if you can, how how that relationship would work with a client. How many times you talk to them in a week? How are you working with people to really empower them to change?
So for me, I have a small market that I work with, more of a concierge business. And so, I know if they did their workout, I'm watching, because they all have watches. I've been working with Garmin for 20 years. They're, and people have Apple watches, whatever they have. But I'm tracking on my phone and seeing every single day the exercise that they're doing. They're texting me photos of their food, so I know what they're eating. And I'm in communication with clients pretty much every single day. So it's a daily communication. And then I have an hour once a week on Zoom or in person if they're here in Naples, which is where I live, Naples, Florida. But 90% of my work is online. And so, outside of that 1 hour session that I have with a client, every single day or every other day, I'm in some form of communication. And that can even just be a motivational tip that I'm texting them. If I say, how are you feeling? And they say, I'm feeling down, I'm depressed, I'm lonely, I'm, having a hard time getting motivated. It just may be a little inspirational thing that I send them. And then I see they did their workout an hour later. So it's just this constant little contact that they feel like someone's holding their hand, in their daily life.
And have you seen that results in more sustainable change long term as you've worked with people, 6 months, 12 months?
As far as
sustainable lifestyle change, like they actually move into a place where they're more consistently making better choices.
Yes, I actually had a Zoom call with a general manager of a television station who I worked with 10 years ago. And I sent him a text message and I said, are you still skinny? And he said he is. And so I had a call with him. It's been 10 years. He's kept off 65 pounds. I mean, this is, as I live a whole food plant-based lifestyle, and I go by the SOS diet, no salt, oil, sugar. And so I educate most of my clients if they're willing to do that type of diet. And I have found that diet especially has really been a long-term, even when they're finished with the 6-month program or a year-long program with me, it is a long-term diet lifestyle that they've stayed with. So that's always exciting to see.
That is exciting.
Yeah.
And I know you believe, like I do, that there's a tremendous opportunity, untapped opportunity for health coaches to begin working with lifestyle medicine clinicians. How do you think that plays out, or how does that look going forward? How can we begin bringing that together?
I think it's a matter of, I've always, as I mentioned to you, I've always wanted to educate health coaches to be able to teach them that you gotta, it's hustle. It's like when I first started my career, I don't know about you, but I was out there, meeting everyone and anyone that I could meet to build relationships with. And so the same thing with health practitioners. So when I have a new client that comes in or a new client's referred to me, I want to know who they're working with, and I'll send an email, I'll get on the phone, everyone's busy today, so it's more of an email, but just getting in, getting out there, getting really interested, that health coaches can get very interested in who are their clients working with outside of the health coach, and building those relationships. So I think it's really more of the health coach being able to get out there and get interested in who their patients, their clients are working with outside of them. Right. And building those relationships, and so that everyone's on the same page and that we're not separate. We're all trying to, make our patient, our client, as healthy as we can.
That's right. We're all in the people business, trying to improve people that we come in contact with, and helping connect them with the resources that they really need to make a lifestyle change. It's more than evidence. It's more than science. Science is a component, but it is truly relationships with people like yourself, health coaches, dietitians, fitness professionals, and community, and supportive community that is really crucial. So I'm so glad you're going to be at the conference this year.
Me too.
There's so much that I think you have to share, and I'm really excited for our audience to be able to tap into your, decades of work and the deep resources that you actually bring to the table that is, exceptional, I think, especially in the health coaching world. And so I'm so delighted that you're going to be there.
Thank you. I can't wait, and looking forward to meeting everybody, and just being a voice for health coaches out there. Because one of my dreams has always been for health coaches to be known just like nurses are, that we are just as important today. Because as you know, people really want connection more than ever today, and having someone to sit and talk with. And I think that's a big part for health coaches, is just we are sitting there listening. and people have a lot to say.
They do.
I always say to health coaches, zip your mouth and say nothing. And if you get a word in, except when you're educating, but people want to talk today and they really don't have a lot of people listening anymore. And I think that's a big piece. So
it is. Love, a little love goes a long way in working.
It does. It does.
And so for all of you watching, health coaches, healthcare professionals, the conference is September 16th through the 19th in Desert Palm, California, Palm Springs, the JW Marriott. We have an amazing lineup of speakers. More than half of them are new to our conference. Incredible new content. And we have this, this panel that's at the end that really takes a deeper dive into application, where Michelle's going to be joining us. And we would love to have health coaches attend this year so we can begin creating these relationships, building bridges that currently don't exist, and begin connecting clinicians with health coaches and building out that network that is essential, but is, you know, really just in our minds right now. So,
and I think a way to get health coaches is sharing too, that there's going to be food provided.
The best food, right, Michelle?
The best, cleanest food you can get. Yes.
That's right.
That was a draw for me.
Yeah, 3 delicious meals, sitting with amazing colleagues, breakfast, lunch, and dinner, being inspired and encouraged. It is a fantastic couple of days that will fill your tanks for the remainder of the year.
Yes.
So, Michelle, thank you for being here. I really appreciate it, and thank you so much for being a part of our conference this year.
Thank you, Scott, so much. Looking forward to it.
Yeah, thank you. And for all of you that are interested in the conference, go to plantritionproject.org or pbnhc.com. That's the conference website. You can sign up, and we have food, hotel rooms all set aside. And it will be an amazing conference, but especially an incredible opportunity to connect with like-minded colleagues and take away information that will really change the way that you practice. So thanks to all of you, and thanks again, Michelle. Thank you for your time today.
Thank you, Scott. Looking forward to seeing you next month.
Me too. Thanks. Bye-bye.